Hi everyone, I'm Dr. Roman and I'm a blood and cancer doctor. And on this video, I want to do something completely different. I want to try to figure out what the heck caused our IPMN. So those of you who do not know me, I was diagnosed with 2 IPMNs in my pancreas about, give or take, about a year and a half ago. And I can tell you that since then, it's not been easy for multiple reasons. I mean, number one, I'm a cancer doctor and I'm seeing cancer patients all the time. And every single time I see an IPMN or a pancreatic cancer patient, I can tell you it plays mind tricks on me. But, you know, even since that diagnosis, just living with the fact that I have a pancreas cancer risk factor, it's just not easy. And those of us who have an IPMN know exactly what I am talking about. So what I've been doing is I've been really breaking my head trying to figure out why me? Where did this thing come from? You know, and we know, or at least we think, that the IPMN comes from DNA damage, from a possible genetic predisposition to these things. And then this damaged DNA causes the IPMN. It gives that dysplastic tissue. And if you don't know what I'm talking about and you want to learn more about an IPMN, I urge you to find my video titled IPMN and Pancreatic Cysts, where I go into a lot more detail as to what exactly is an IPMN. But in this video, what I want to try to do is I want to hear from you. So I'm going to give you an example. I've been breaking my head trying to figure out why me. I never drank, I don't smoke, and when I say I never drank, I mean I would drink 1 glass of wine every 6 months, if that. I never smoked, I've never been overweight, I've always been pretty healthy, I've exercised. I can honestly tell you I've taken care of myself. I have not taken any medication chronically. I have taken heartburn medications from time to time. But other than this, I have really been healthy overall. Now, the one thing that I have had since I've been a child is some pretty bad heartburn. So this gastritis or GERD or heartburn, however you want to call it, since I've been a kid, I've been getting this acid reflux. And it's been quite a thing to deal with, because when I was very young, I was, there were times that I had to take the typical heartburn medications, as well as Tums and all these other heartburn drugs, because if not, I could not sleep. So that's really the only thing that I can attribute as a possible cause for my IPMN. You know, I'm thinking, could it be that this very low gastric pH, this acidic environment in my stomach, in the vicinity of my pancreas, could this have provoked my IPMN? I don't know. But it's really the only thing that I can try to link it to. So what I want to do is that I want to hear from you. I would like for you to sit down and really think, what do you think caused your IPMN? And if you don't mind, send me a message either through Facebook or right here on YouTube. Just write a comment, and I want you to try to keep it concise. If you've had, for example, back pain for 6 months, that's highly unlikely to be the cause of the IPMN. So I want you to really think about it. So for example, heartburn, if you've been overweight the majority of your life, if you're a long time smoker, I don't know, whatever comes to your mind. Maybe you have a connective tissue disease like lupus, scleroderma, or you've had you're a long time drinker. You read on the literature, and things that increase the risk of an IPMN is, for example, maybe smoking, maybe drinking, maybe family history, etc. But not much is really known. I mean, unfortunately, IPMNs is something that we really need further studies on. And I thought that, why not start with us? I mean, we have a community of patients out there with IPMN. I'm among us. And why not share some of this information, keeping it anonymously if you'd like. But let's learn from each other. So please send me a message, and I'm going to try to tally up some of these diagnoses, and maybe we find a common theme. Maybe I'm not the only one with heartburn and IPMN. Maybe it's very common among us. Maybe patients who are overweight, or I don't know. I'm just trying to learn more, and knowledge is power, and that's the goal of this video. So I hope to hear from you. Send me that comment. like, subscribe, and once I have a lot of information, then I'll make another video and I'll share it with you. So I'll see you then.